Hello and good morning. My name is Sarah Cutchin and I'm the partnership lead on the Adolescent Immunization Communications team here at CDC. And so we're very excited that you can join us today for a partner resource showcase as part of our Preteen Vaccine webinar series. Before we get started, I have a few housekeeping items to go over. As a reminder, there is no dial-in number associated with this webinar, and so all participants should access the audio through their computer or internet mode. All participants are kept on mute, so if you have any questions, please write them in the chat box. The chat box can be found in the corner of the webinar screen, and so please be sure to direct your question to the webinar staff by selecting the option on the drop-down menu. As we'll be addressing questions at the end of the presentations, it would be super helpful if you could be sure to note which presenter your question is for, since we have multiple speakers today. So with that in mind, today's webinar features a few different speakers as they'll be sharing some of their newly created HPV vaccine resources. Our partners today have been funded to address low HPV rates on multiple levels, and so these approaches include bringing HPV stakeholders together to create a national network, through supporting local health departments to increase HPV vaccine recommendations, and then as well as by engaging professional clinical organizations to strengthen the quality of the HPV vaccine recommendations that are given. They've created a variety of resources that they'd like to share with y'all today, and we're excited to facilitate this. And so with that in mind, I will let them get to it. Today we're going to start with Dana Bright, who's at the American Academy of Pediatrics.
Good morning, everyone. Hello, my name is Dana Bright, and I serve as the staff manager for immunization initiatives at the American Academy of Pediatrics, otherwise known as the AAP. And I also serve as the project director for the HPV cooperative agreement between the AAP and the Immunization Services Division there at the CDC. And on behalf of the staff here at the AAP who work on HPV, I want to extend my thanks to the CDC for including us in this webinar and providing us the opportunity to share with you some of our HPV resources. So with that, I will dive right in and tell you a little bit about the first resource that we have to highlight, which is our HPV Champion Toolkit. And with that, we can go to the next slide. So this toolkit is a compilation of the best resources available for clinicians, parents and caregivers, and educators to help you educate yourself and others to make necessary changes in practice to improve HPV vaccination rates. And by focusing on the ways that you can make changes that will lead to improved HPV vaccination rates, you all are champions for HPV. And this toolkit hosts resources developed by us here at the AAP, as well as those developed by the CDC, the Immunization Action Coalition, American Immunization Registry Association, among others. And there are two sections of the toolkit in particular that I wanted to highlight, both the printable resources and the What's New with HPV Vaccine section. So within printable resources, here we have handouts for parents and caregivers from the CDC, such as the easy-to-read adolescent immunization schedule, what parents should know about vaccines for preteens and teens, and links to the vaccine information statements. For clinicians, we have printable materials that target nurses and medical assistants, information about HPV vaccine safety, and information on how to talk to parents about HPV, as well as tips on how to be an HPV champion. Also highlighted in this slide, you'll see is a screenshot of our What's New with HPV Vaccine section of the toolkit. And in this area of the toolkit, we have posted some of the latest updates regarding HPV vaccine from the CDC and the Advisory Committee on Immunization Practices. And we also have posted information about a recent webinar that the AAP did, our 2017 HPV Vaccination Update webinar, which I will discuss in a few moments. And we encourage you to check back on this particular section as we are continually updating the information about the latest and greatest on HPV. Additionally, to help those who want to educate other healthcare professionals about HPV and the vaccine, the HPV Champion Toolkit includes videos, various social media posts. We have resources that folks can use for grand round presentations or for resident teaching sessions. And we also have links to information about continuing medical education opportunities as well as maintenance of certification opportunities. A couple more things I wanted to note about the Champion Toolkit. To assist clinicians in discussing HPV vaccination with parents and caregivers, the toolkit includes patient, parent, and caregiver-focused handouts and social media posts for parents and caregiver audiences. For those clinicians interested in looking at making changes in practice and/or systems to improve HPV vaccination rates, the toolkit includes fact sheets and tip sheets and training guides focused on topics such as reminder recall, the use of team huddles, use of a state immunization registry, and various ideas around quality improvement activities. Finally, the toolkit includes a set of some key talking points that pediatric healthcare providers can use in discussions with patients, parents, and families about HPV vaccination. One thing I wanted to note, we are in the process of going through a pretty major review of all of the content in the toolkit. We know that once things go online, it's definitely a chore to keep that information updated. So if you happen to see anything that you know needs updating or have ideas for new information that we can add or better resources that we can link to, please do let us know. And our contact information is listed at the end of the presentation from the AAP. So we'll go on to the next slide. So as I mentioned, the HPV Toolkit includes a link to the copy of slides, a recording, and the Q&A for our 2017 HPV Vaccination Update webinar. And we held this webinar back in March to great acclaim, and you'll hear soon from Dr. Sharon Humiston, who served as the MC of that webinar. And Dr. Humiston helped moderate for us a panel of experts in pediatric primary care, infectious diseases, obstetrics and gynecology, and ear, nose, and throat. And our panelists covered the latest trends in HPV disease prevalence and prevention, including touching on the updated 2-dose HPV vaccine recommendations. Our panelists also covered various tools that can assist pediatric office staff who may have questions about the timing or the scheduling of the HPV vaccine. Our panelists also covered issues around safety and effectiveness of the HPV vaccine, evidence-based techniques for increasing HPV vaccination rates, which, as a lot of us know, have historically lagged behind other immunization rates. And finally, the webinar addressed some commonly asked questions that providers may receive from parents. We had 700 individuals register and over 300 people participate in the live event. We received fantastic feedback. In fact, a couple people even said that this had been the best HPV webinar they had seen to date. So we were very excited to receive that positive feedback. And the last thing I wanted to note about our webinar is that we recently worked with the Boston University School of Medicine to make free continuing education credit available for the webinar. And here on the slide you can see we included a snapshot of that web page as well as a hyperlink to that page. And we'll go on to the final slide, and the final thing that we wanted to update you all on in terms of resources from the AAP. So we have information about all things immunization from the AAP can be found at aap.org/immunization. This is really our go-to place here on the AAP website. And these pages within aap.org contain immunization content for pediatricians and other immunization providers. Specifically, our site includes info on vaccine preventable diseases, as well as the policies of the AAP around vaccination against those diseases. We have information about the various immunization campaigns that we participate in, including the National Immunization Awareness Month. Our website includes information about various educational courses, practice change tools, a variety of resources specific to practice management as it relates to HPV and other vaccinations. So information about things like storage and handling, vaccine administration, communicating with families to address their concerns and vaccine hesitancy, financing, vaccine ordering, maintaining supply, you name it, the list goes on and on. We certainly also have a link to our HPV Champion Toolkit that I mentioned and other information about HPV. And finally, we link to information about state immunization registry contacts, as well as a new infographic that the AAP developed, which provides a snapshot of immunization coverage rates, exemption and outbreak information by state, and you can see there a picture of the map of the U.S. with a link to that infographic that I mentioned. So the AAP.org/immunization web pages recently went through a pretty major revision in the sense that we created a much cleaner outline that allowed for more logical placement of our resources. So hopefully that will allow you and other users to navigate the information a little bit easier and more effectively. The final thing I wanted to mention is that another area of our AAP.org website is information around payment related to vaccines, which may be of particular interest to some of you on the webinar today. So the Academy works with national payers on an ongoing basis to advocate for adequate vaccine payment for the payers' commercial and Medicaid managed care plans. So what we've done is created multiple business case models to support physician practices and uploaded those to the website. And so these resources include various tips on analyzing and effectively negotiating with healthcare payer contracts. So I just wanted to be sure to put a plug in for that information as well. So I'm going to bring my comments to a close, and we can go on to the final slide here from us at the AAP. So we hope that these resources sparked some interest or excitement, and most importantly, we definitely hope that these are resources that you all will find useful and kind of targeting some of the needs that you have in terms of resources. So I've listed here on the final slide members of the wonderful team here who work on our HPV cooperative agreement between the AAP and the CDC, as well as how you can contact us with any questions about the resources that I mentioned on today's webinar. So again, we really, really want to thank the CDC for this opportunity. And with that, I will conclude my comments and we'll go on to the next presenter.
Thank you so much, Dana. Excellent overview. So next up we have Jen Cienko from the American Cancer Society and the HPV Vaccination Roundtable. Jen?
Hi, yes, good morning. And thank you for inviting us to present on some resources today. So I have a lot of slides. I'm going to go through them very quickly. We can go to the next slide. Can we? Yeah. So in our time today, I just want to introduce some of our resources and encourage you to deploy these tools in your own work. And hopefully these will not be the first time that you are hearing about or seeing these resources. Next slide. So if I do go through this quickly, you can find everything that I'm about to show you online, either on our public-facing SharePoint site or on our cancer.org roundtable site. Now, I will say that the HPV Vaccination Roundtable is in the process of designing a brand new website, which will combine all of the information on these two websites. But until that launches at the end of the summer, you should be able to find everything between these two sites. Next slide, please. So just a couple of social media resources. Next slide. We are on Twitter, and we love to retweet and favorite our partners. So if you are not following us, I would encourage you to follow, and we will shout out your resources and hope that you will follow us and shout out ours. We do have a hashtag. It's hashtag 2shots2stopcancer. And yeah, there you go. And we tag a lot of our resources with this hashtag so that we can then go back and see who's using it and gauge online social media engagement, but we would encourage you to use this hashtag or include it as a tool for your social media team. Next slide. We also have a Facebook page. It's a private Facebook group for professionals who are communicating around HPV and HPV vaccine. This includes roundtable members, but also local health educators or people from state health departments. We would encourage you, if you are not a communicator on behalf of your organization, to forward this link to maybe your social media team or the person who has responsibility for communicating about social HPV and HPV vaccine online or in print, so that we can all share resources and then sort of also have a forum for discussion around what's working, what's not working, and really just create a community for communicators. Next slide. Hopefully, most of you are aware that we, the Roundtable, are running a social media campaign over the summer. This is really provider focused and has a message sort of back to school focus with this cheerleading, you're a superhero, keep doing the great job that you're doing recommending HPV vaccine to your patients kind of messaging. You can get all 10 weeks of content at the SurveyMonkey link, and we will be doing a special bonus week of material for National Immunization Awareness Month, Preteen Vaccination Week. I would love to talk more about this, and if you have questions, I would be happy to answer them at the end of the presentation. Next slide. We also have traditional communication tools. Next slide. We have developed a brand neutral "We're in" symbol, and this is really to be used in addition with your organization's logos or to complement your organization's activities in the space. It's not a pledge. We're not extracting a promise from you to do a certain thing by a certain time, but we would love for you to use this symbol in conjunction with your work so that we can begin to visually brand all of our activities towards this idea that HPV cancer prevention starts with HPV vaccination. You can download it at this bit.ly link, and if you have any questions, I would be happy to answer them. Next slide. Oh, these are just some ways that I have used the symbol. I created coffee mugs and zip drives. I've added it to my email signature. ASCCP added it to their website. So there are a variety of ways you can incorporate this symbol into your work. Next slide. We do have a monthly e-newsletter, and I would highly suggest that you sign up. We love to promote our partner resources. So I know the AAP Champion Toolkit has been spotlighted in our newsletter, but we also have updates on CME and MOC opportunities, as well as links to roundtable resources and other resources. Next slide. We have some multimedia resources for you to use. Next slide. A big one is our survivor and provider videos. So these are recorded vignettes, often between 2 and 5 minutes, of HPV cancer survivors and their providers. And so these are very powerful to use if you are not able to invite a speaker to your conference or your grand round or your training. You can embed them in PowerPoint. You can embed these videos in social media. You can post them to your practice website. Next slide. If you are able to invite a speaker, we have a database. We've tried to make it very easy for you to find a speaker either in your area or for the cancer type by which you want to educate people. And so we list the organizations and contact information of those organizations that have speaker networks of survivors willing to tell their stories. Next slide. We have a very powerful video from our own Dr. Debbie Saslow on explaining why it's so important to vaccinate at this 11 and 12-year-old age. And this standalone video is available on YouTube, and it really succinctly explains our position on why we focus on this age group. Next slide. We have some provider education tools. Next slide. Including a new CME video for pediatric and primary care providers on increasing adolescent immunization coverage. This is an e-learning module that we encourage you to check out, and it does have a CME credit. Next slide. We have an oral pharyngeal video. Dr. Day out of South Carolina narrated this for us, and it really explains the link between oropharyngeal cancers and the HPV causation factor there, and why, and he makes the case to pediatricians specifically about why HPV vaccination is so important to prevent kids from becoming his patients. Next slide. We have a toolkit specifically for school nurses, and this is really a whole health toolkit that does include positive messaging around all vaccinations, including HPV vaccination. And we are talking with the National Association of School Nurses for them to take this on as a permanent feature, but for now you can find it at middleschoolhealth.org. Next slide. And that brings us to the end. So if you have any questions, you can contact us at HPV Vaccination Roundtable at cancer.org. It looks like the formatting there sort of got, yeah. So my colleague Jen Conga is also, she's a co-director with me. And if you have questions about health systems or provider engagement, you can contact her. If you have any questions about communication or public engagement, you can contact me, Jennifer Cinco. If you're not quite sure, you can email either of us or the Vaccination Roundtable website, or excuse me, Vaccination Roundtable email, and we will be happy to get you connected to the most appropriate resource. And with that, my presentation is complete, and I shall turn it back.
Awesome. Thank you so much, Jen. That was really helpful. Next up, we have Marcy Fisherborn, who's also with ACS and their VACs project.
Hi, everybody. My name is Marcy Fisherborn. I work with our health system staff within the American Cancer Society. We have roughly 400 across the country who work on a state level, work with clinical practices, work with commercial health plans to increase HPV vaccination in a variety of ways. Next slide, Sarah. So I've gave a little overview of the VACs project. I'll say that following Jen Cinco and Dana, at this point, probably your brains are very full with incredible amounts of resources, all of which are extraordinarily high quality. So it's exciting to get to share two today from the VACs program. Sarah, you can go to the next slide. One of the things that came up early in our work with ACS and our staff around the country were, how do we handle some of the myths, some of the misperceptions that are out there around the vaccine? And so we wanted to create a tool that we first really created for our staff to go out when they were working with provider audiences and in clinical practices to talk about not the myths, but what are the facts, and to do it in ways that had links to the evidence and had really quick talking points. So this document has 10 key facts about the vaccine, small talking points. It's been recently updated, and we find that it's been a pretty important short tool to use to talk about all of the really key pieces about why this vaccine is cancer prevention. Next slide. My second tool is actually a slight cheat because it's mini. And Dana mentioned earlier the AAP toolkit. That toolkit is within this document. We have a tool that we've been using with our clinical level interventions called our STEPS guide for how you increase HPV vaccination in practice. And on the slide, you'll see a bit.ly link to that toolkit. And essentially, this tool is a roadmap walking through 4 key steps to increase vaccine rates in clinical practices and to give clinicians and the clinic systems some evidence-based tools to do that work. We launched this tool in 2015. We had 30 FQHC systems, so roughly 300 clinics that implemented this tool, gave us feedback on this tool, and we're now working in over 500 clinics using this particular process. Next slide, please. So, overview of the STEPS guide is that it walks through foundations of quality improvement to help build towards interventions change. So really the first 3 steps are about capacity building, and that last step is providing the particular evidence-based intervention. And we had one pilot project, for example, that would print off this page. This can both be an electronic and a print resource. Would print off this page and check off, okay, so we've identified our clinical champion. We have our quality improvement team. Who else can help us? What are some other great resources, some other great partners that we can pull into the practice? So just to say, not only as a virtual electronic resource. This has been something that people sort of pulled out and used as a sort of action guide to move through the steps in clinical systems change. Next slide, please. So, step one, I mentioned some, but do we know we have a champion? Is there a team, whether it's our existing quality improvement team, or would we want to form one specifically to look at our HPV vaccine rates? Who are those resources? Who are those organizations that are going to help us along the way? Next slide. With each of these steps in the tool, you're taken to a SharePoint site that walks through the different resources that are available. So I want to start a quality improvement team, but I'm not quite sure how or what a QI plan might look like. So in step one, you'll find a link page that will take you to a number of resources, not just ACS. Here on your screen, you see AAP, AHRQ, a number of different tools that are going to help move through the process of assembling a team. Next slide, please. Step two is around how do we make a plan? What are the evidence we need internally? How do we understand our baseline coverage? In our work with clinical systems, this has been a real challenge. What are those ways that we determine our vaccine baseline rate? So again, with step two, next slide please, Sarah, you would find electronic resources that would help you move through that plan. The third step is how do you engage and prepare all staff? So whether that's your clinicians or whether that's your non-clinical staff, what are the tools that you need to do that? How do you prepare your clinical system? How do you prepare your patients? So resources like the CDC print posters and handouts are linked to in this particular step. Next slide, please. The fourth step is are those evidence-based strategies? How do you make an effective recommendation? What are the tools that are going to help you get there? And again, with each step is a bit.ly link with numerous resources from numerous organizations to help get you there along the way. Next slide. All right. With that, I'll turn it back over to Sarah. If you have any questions, we'll take them at the end of the call. Thank you.
Thank you so much, Marcy. Excellent. So next we have Dr. Sharon Humiston. She's from the Academic Pediatric Association.
So APA is the Academic Pediatric Association. We are small but mighty, with almost 2,000 members who are leaders in subspecialties, including pediatric research, quality improvement, and medical education. Our journal is the influential Academic Pediatrics, not to be confused with magazine. And I do want to say our children and our cats may be distinguished from other people's children and cats. Okay, two key HPV vaccination resources that you can use today: the APA HPV Speakers Bureau and the toolkit of the National Immunization Partnership with APA, also known as NIPA. So our Speaker Bureau, this targets large audiences, primarily of healthcare providers. The speakers are primarily physician leaders who have published in the field of HPV. A lot of them are pediatricians, some are OBGYNs, and we've even had some ENTs. We cover the cost of the travel and a small honorarium. And for more information, contact Christina_Alberton at urmc.rochester.edu. We also have a toolkit, and like the other toolkits you've heard about, we have some project references and tools and resources. But the part I really want to focus on is these strategies and protocol pages. You see here that there are 3 templates at the top for protocols for provider prompting, protocol for standing orders, and a protocol for reminder recall. Those are the 3 main interventions that are typically used in quality improvement. I've included in your handouts on the sidebar one of the templates. I think we used reminder recall, as well as NEPA's menu for practice changes. So this is a listing of improvements that a practice can make. At the bottom of the slide, you can see the NEPA training modules. Now, these are something different. These are 4 15-minute quality improvement videos that take a novice and help them through the initial, what is quality improvement about? So again, for novices, they can learn the essential concepts and feel confident enough to launch a meaningful project. After watching these 4, they're cut into 4 brief videos so that you can watch them, between patients or on lunch break. And all of the examples relate to adolescent immunization. That was one of the things the other quality improvement videos use a lot of examples from adult medicine. So we made these focus on immunization. You can register for CME for those 4 videos through this website, or you can go directly through APA's website, shown here. I also want to point out at the top of this page, there's CoreNet project page and a NIPN project page. These are project pages for waves of quality improvement that have happened through APA. NIPN is for primary care offices. CoreNet is for residency programs. And on these project pages, there are helpful links to help you through, to see the examples of the timelines, how to collect data, the webinars that we've used, quality improvement strategies, and as well as the tools and resources. And so those are useful if you're starting quality improvement in your own AAP chapter or your own office. But if you want to actually join the next wave, you can reach out to Holly, whose email address is shown here, holly@academicpeds.org, or you can reach out to Rachel, whose email address is shown there. Coming soon, Academic Pediatrics is going to have a complete supplement just on HPV. Now, one of the things that we're excited about is that one of our special interest groups in the past has done virtual reality curriculum for pediatric residents to decrease influenza vaccine refusal. They are now working on a virtual reality curriculum for pediatric residents to use to help them with parents who are hesitant or refusing HPV vaccines. To see more about that, you can go to the YouTube link. So then the other thing I wanted to show you is we are launching after Labor Day a suite of interactive online training modules that learners can use on their phone, tablet, or computer. You can link to it directly yourself at that link there, but I want to take you there now. So what you're going to see here, and let's see if I can, no. Okay. This is what they look like. You can go through the lesson on a computer and just see it full size. And then after a little bit of reading, there's usually an interactive question. So let's see, we pick that answer and we submit the answer, and it tells us that we are correct, and it tells us a little bit more about it. Now let's go to lesson 2. If we wanted to see this, though, on something other than a full-size computer screen, you could see it on a tablet-size screen, and it can be that way, or landscape. But we can also do these kind of interactive modules on your phone. And I love this because we know that a huge proportion of people doing learning nowadays are doing it on their phone. So now we pick an answer to this, we submit it, oops, and we're incorrect, and we learn about how we're incorrect, and then we move to the next lesson. We've tried to make these really interactive so that it's not just reading or not just watching videos. You have to keep doing something as you're learning to keep things moving, or they won't learn. All right, I think that's it for me. I'm hoping that soon there'll be an entire suite of these, but the one that you saw today on the HPV schedule is there now. All right, thanks for your attention.
Thank you so much, Sharon. Next up, we have Kimberly from NACCHO. Kimberly, are you there?
Yes, I'm here.
Excellent. Go ahead.
I was waiting for the slides to transition, Doc.
I think they're good on our end. You can go ahead.
Okay, I still see American Cancer Society up. Oh, there we go. Great, thank you. Again, my name is Kimberly Scott, and I'm a senior program analyst with the National Association of County and City Health Officials. I specifically work in the immunization program. NACCHO is a member organization for local health departments, and we aim to provide a voice for the nation's local health departments and their work. Next slide. We can transition to the next slide. Great, thank you. NACCHO's HPV work and their focus largely came out of our HPV Demonstration Sites project. It's a project aimed at increasing HPV vaccination rates as a means of strengthening immunization infrastructure in local health departments by working to increase their capacity to prevent and control vaccine-preventable diseases. As a part of the HPV Demonstration Site project, we funded two cohorts of local health departments, the first in 2014 and the second in 2015. Those cohorts included 10 local health department awardees, all from states that were designated as having the lowest HPV vaccination rates. The site project was really four-pronged. We asked that the local health departments develop community action plans to reflect 6 themes. The 6 themes were reinforcing the message that HPV vaccine is cancer prevention, to work with schools to improve HPV education about the vaccine, engaging partners as immunization champions, increasing access to the HPV vaccine, identifying opportunities to improve data and evaluate progress, as well as to educate and support providers in the community. So NACCHO's work was really to provide technical assistance and other capacity building support and help them to identify strategic focus areas to guide a project and implementation while working with a variety of stakeholders such as state immunization programs, cancer and immunization coalitions, medical providers, pharmacies, schools, and other faith-based organizations. Next slide. Can we transition to the next slide? Great, thank you. Out of this project, we developed an advisory board as well as hosted technical assistance and capacity building meetings. So with the advisory board's assistance, we came up with a guide to HPV resources for local health departments. The main focus of this toolkit is to provide a guide specifically for local health departments and their efforts to create an awareness campaign to increase their HPV vaccination rates in their communities. The HPV guide includes educational and communication tools that can be adapted for HPV project planning. Also, it encourages local health departments to learn more about HPV content, as well as share resources with providers, parents, and adolescents in the community. The resource guide incorporates a variety of resources for local health departments' outreach to providers, parents, and adolescents, and also coalitions, as I stated. The Guide to HPV Resources for Local Health Departments incorporates toolkits, websites, print materials, infographics, as well as video and communication resources. Next slide. The guide is really divided into 4 main sections. We offer a section engaging parents and adolescents, engaging providers, engaging all audiences, as well as resources for collaborating with roundtables and coalitions. The engaging parents and adolescents section is really focused on utilizing resources, can be used to utilize to increase HPV vaccine awareness and knowledge for parents and adolescents. The engaging providers resources promote information for providers on the benefits of the HPV vaccine, tips for talking to parents and adolescents, as well as strategies for increasing vaccination rates. The engaging all audiences section can also be utilized for outreach to the greater community to improve HPV vaccination rates. And that really includes infographics, data and statistics, audio and video communication, print materials, guidance documents, websites, and other online tools. And the last section that I mentioned was collaborating with roundtables and coalitions. And this really is a review of information about coalition work around the country and their efforts to improve vaccination rates, and it will assist local health departments in identifying potential opportunities for key partnerships. So again, the guide was initially developed earlier this year. However, we are currently in the process of updating the resource guide and the toolkit and all of the other materials. As you can see on your screen, those are 3 snapshots of some of the types of infographics that some of our local health departments that participated in the HPV demonstration sites projects adapted and/or adapted to their programs from the You Are the Key or other CDC and some other national partner messages. But these are also tools that we've included in our resource guide so that other local health departments know that these materials can be accessed and adapted for their use and purposes as well. So again, the toolkit is available on our NACCHO website and is in the resources toolbox section of the website. Next slide. Well, our next slide is really just contact information for our NACCHO immunization staff. There we go, thank you. We have Lily Kahn, who is our Senior Director, Michelle Cantu, our Director, myself, Courtney Martin, and Nyana Kwashi. We are all immunization staff and can be contacted if anyone has questions or would like additional information about the NACCHO HPV Resource Guide. So that really wraps up my comments, and I will turn it back over to the organizers.
Thank you so much, Kimberly. Last and certainly not least, we have Gretchen Forsell, who's joining us from the National AHEC Organization. Gretchen, I just want to let you know that we don't have any questions that are super specific, so we're good on time. With that, go ahead.
All right, thank you, Sarah. Yes, I'm Gretchen Forsell, the Project Director with the National AHEC Organization on our CDC HPV Project. Next slide, please. It's probably important that I share a little bit with you about what AHECs are and what the National AHEC Organization is in case you're not familiar. AHEC centers are located in 45 states across our country, and the main purpose for an AHEC center is to enhance access to high-quality, culturally competent health care through community-based interprofessional training of health profession students, continuing education for current health professionals, and health careers outreach activities to improve and enhance the number of health professionals across the country. So we're a unique organization that works to improve health care overall across the country with a special emphasis on rural and underserved communities. The National AHEC Organization then is the membership or association that supports and advances the activities of AHECs across the country. And by doing that, we work nationally to provide opportunities for our AHECs to be used by larger organizations and entities across the country because of the fact that we do have so many locations for people to have access to. Currently, in our 45 states, there are over 300 AHEC locations, which are a variety of academic-based program offices which support the activity of AHEC centers. There are a variety of AHEC centers in each state, so not every state will have the same number, but for the most part, all counties or parishes within a state will be covered with AHEC activities. So hopefully that gives you a little overview of who we are, and it'll make a little bit more sense about the opportunities that we have. Next slide, please. So what we do in our CDC project is basically a lot of provider education. At the state level, we do provider training, either, like I said, state level or local level, and that can include activities such as, but not limited to, webinars, face-to-face trainings, large or small-scale conferences, regional conferences, or even assisting with a national conference that might be held in a specific state. We also do a lot of lunch and learns and assist with grand rounds with our academic AHEC partners. We also, because of our unique niche in assisting health professions training programs at the academic level, AHECs are doing HPV training for students in health profession training programs. This could be nursing students at an LPN or BSN level, nurse practitioner, PA, pharmacy, medical students, particularly those who are doing third-year clerkship trainings in our rural or underserved sites to see what actually happens when you're out with a provider. So those are exciting, unique opportunities that we have to actually train students just a little bit better and show them some of the new things that are going on so that they're ready to go once they're out in practice. At a national level, NAO is doing a variety of national webinars which many times provide CE or CME. Not all of the programs do, but a majority do. And then we have those archived and available for folks on our website. We're excited about one of our latest that will come up on July the 25th, where we will be doing a presentation on HPV cancer prevention, Give It a Shot or Two, with Dr. Debbie Saslow from the American Cancer Society. And Jennifer showed you a little bit about the short snippet that they have on there. And we've asked Debbie to help us and do a little bit larger scale presentation because our AHECs are very interested, and most of the clinicians want to know how to get the information across about why is it 2, why is it 3, why do we need to do it at this age. So we're excited about that. And there's information on the handout that we have available here today for you to download on how you can register for that. We also have online CME and CE study guides that are available. One of our most exciting is that of vaccine safety, and can provide additional education and learning information on why the HPV vaccine is as safe as it is, how it's happened, and can give you other resources, particularly as a clinician, to share with your patients and other staff. Next slide. We also have resources available on our website. These are just a couple copies. You'll notice they look alike, but they're really not. These are our state fact sheets. There's one for every state, plus the District of Columbia. And these provide information such as state versus the U.S. and HPV incidence. It includes information about coverage rates for states versus the U.S. and much more. They're available for download and can be used by anyone to provide for their staff or in training or even in meetings, et cetera. And so those are available, and they will be updated in the coming year after the new information on immunization rates comes out. Next slide, please. We also have a vaccine resource book. This was originally developed to assist our AHECs and others in the understanding of vaccination, and in particular HPV. But it was found out very quickly that this resource was of great interest by a variety of AHEC partners across the country, and so we've expanded and have it available on our website. You see just a couple little pages that showcase it is a lot of text, but it's a great primer for folks on things such as HPV coverage, vaccine information, and much more. And like I said, this is available for you on our website, which is in the handout, and you're welcome to go and download that. Next slide, please. Here's just a quick snapshot of the website that we have available for the HPV project. There's a variety of information available there that you're welcome to use. Again, our archived webinars are available for viewing. There's project highlights, and you can check by each of the colored regions that are noted on that map what AHECs have done and or will be doing to provide provider training, partnership training, or student training within the region. And all of the resources which I've shown here today are available on that site. In addition, direct links to our free CME information and our CME programs, and also registration for our upcoming webinars that we have available. So there's a variety of information there. And then finally on our last slide, which you can get on the handout, is just some contact information for you to get in touch with us. We'd be more than happy to assist you, and more importantly, I'll direct you to specific information that you would like to know related to the state that you are in, or the or joining states where you might need to have educational opportunities. And with that, we'll go back, and I imagine, Sarah, there's possibly questions that we could all answer as we move forward. Thank you.
Thank you, Gretchen. Actually, I think it might be official. We have overwhelmed them with information. Lots of good information. So as a quick reminder, if anyone has a specific question, you guys can go to the chat box in the webinar platform and be sure to select the webinar staff as the audience so that we can see your questions. For the few general questions that we have, yes, this webinar is being recorded, so we'll have the recording available to you in a few weeks. We are also planning on sending out the slides as well as the handouts in an email to everyone who has registered. So even if they weren't able to attend today, they will receive that information. And then finally, if you have any general questions for the CDC, our email address is preteenvaccines@cdc.gov. We are happy to answer any of your questions or direct your questions to whoever can answer them the best. And then, oh look, there are some questions coming through. The two questions, one was for one is related to NIPA and IPA.
This is Sharon. I can't see the question, so if you can read it to me, that would help me.
Okay, sorry, I wasn't sure who that was directed to. So the question is, will there be a new cohort starting for NIPA, and if so, when will they start?
I believe that the start is in January, but the best way to find out the details is to reach out to Holly or Rachel. They can give you the exact date. Sorry,
Excellent.
Sorry to not have the exact date on hand.
Okay, and then Dana, there was a question for you. Is there a PDF or another hard copy version available for the Office Strategies for Improving Rates?
Office Strategies for Improving Rates. Let's see. Let me just go back.
The person is saying the website is great, but many physician offices like to have print resources for staff to read and utilize.
Gotcha, yeah. So in our HPV Champion Toolkit, like I mentioned, there's a section where we do have PDFs and other things to download and print and hand out and things. But definitely if they can contact us at the email that we provided for just specific questions, we'd be more than happy to help.
Okay, great. And then we have a question for Jen. She said that, so Lana said that she received a button from the HPV Roundtable, but she's had providers ask how they could get them for their staff. Is there a way that you can distribute the buttons?
So thank you for that question. We've had a lot of interest in things like buttons and pins and lanyards. And I will say that the roundtable does not currently have any that we can give away. We are looking at some creative ways of being able to do that for our members and their constituencies. However, you can download like the We're In symbol and put it on a Zazzle store or a cafe press or a service like that. And then you can have buttons, coffee mugs, zip drives, things like that made for you. So if you think, oh, my constituencies might really like pins, but maybe someone else's constituency would really like grocery bags or lanyards, you can decide that. And then it's one of those things where you would then just purchase them on your own. So currently, unfortunately, no, we don't have things that we can give away for free, but we have made the files available, and hopefully y'all can use them to create things that would be of interest to your groups.
Cool. And then one more question for you, Jen. So the private, there's a private Facebook group for professionals. She's asking, can physicians and nurses working in private offices join that group, or is it more focused on state and nonprofit groups?
Thank you for that question. Yeah, so that Facebook group is really for communicators. So when the group was sort of conceptualized, we thought that our roundtable membership communicators, it would be a good forum for them to share ideas and for us to create some collaboration and some feedback. But then we quickly realized that there was interest from communicators outside of just the roundtable membership, and so we've opened it up. We are really interested in recruiting people to that group who have platforms. So if these physicians are bloggers, or if they act on behalf of a local chapter of their APA or AAP, or they're speakers, or they work with an AHEC, we would love for them to join this group. If they are just really interested in connecting and getting resources, we are in the process of launching a separate Facebook group. It should launch at the end of this month. That will also be a private group for all allies, so parents, grandparents, allies, survivors, individual physicians, and healthcare providers who are interested in connecting with one another, sharing their stories, getting feedback on what's working, getting help when things are not working. And so that Facebook group will be more broadly focused around all allies. And like I said, it will launch at the end of, fingers crossed, at the end of July. And we'll be pushing out information on how to sign up for that in our newsletter, which will go out next week, and then on our Twitter and additionally. So hopefully you'll be able to get that information in a lot of different ways, and I'd be happy to send it to the organizers of this webinar, and they can push it out through their communications as well. That way, if you are not currently subscribed to any of the roundtable resources, but you are getting CDC resources, you can get it that way.
Awesome. Thank you so much, Jen. It is 11 o'clock, so I think we're going to close everything out, but there are a few more questions we did not get to. We can answer these questions individually as we can send out individual emails and make sure you have answers to what you're looking for, and we will do that hopefully no later than this week. Again, that being said, thank you to everyone. Thank you to the presenters for presenting today and for all the participants. Like I said, we will have a recording out in the next few weeks, and we will be sending out these slides hopefully in the next day or two. All right, thank you so much. You'll have a great day.